Now, fetal movement counting has been used for decades and recommended for decades, and there have been many different methods that have been tried. Some of them have been shown to be of some kind of moderate benefit. Most of the studies have not shown a benefit of fetal movement counting in a regular way. We did a study a few years ago where we compared the stillbirth rate after we instituted a program of fetal movement counting that is based on the physiology of the mother and fetus. And when we compared that to the stillbirth rate that occurred for the year prior to the institution of formal fetal movement counting, there was a marked reduction in stillbirth. Since then, in San Diego County and at UC San Diego, we have been doing fetal movement counting for the last several decades, and UCSD has one of the lowest stillbirth rates in the state, according to the state data. So we have reason to believe that it's worth the trouble to do. It's based on the physiology that babies are awake at night and they sleep during the day. Now, new parents are very well aware of this, but in fact, inside the mother, the baby is frequently not moving during the day, and it's not helpful to really be counting baby movements during the day. Whereas at night, babies are very busy, and we can get some kind of fetal movement counting done pretty quickly at that time. Unfortunately, counting fetal movements from 24 to 28 weeks doesn't go very well because mothers don't feel a majority of the fetal movements. Beyond 28 weeks, however, the mothers feel over 80% of the movements that can be detected on ultrasound while watching the baby. So doing fetal movement counting from 28 weeks on till the baby is born is something that has been shown scientifically to reduce stillbirth, and which is, we think, very easy and quick to do. So you've reached 28 weeks, and it's the last third of the pregnancy, and it's time to talk about fetal movement counting. Why do we talk about it? Because of the problem of stillbirth. Stillbirth occurs in 1 in 300 pregnancies, and it's something that we don't want and that we think we can actually significantly reduce or even eliminate. The reason we recommend doing fetal movement counting is the babies slow down their movements if they start to become ill or get into risk. So we use a very simple system. It's a count to 10 system. We just want to know how long it takes to feel 10 movements. We recommend you do it in the evening hours because that's when your baby's awake, and so you can get your fetal movements as quickly as possible. We recommend you wait until the baby wakes up before you start counting, because even in the evening the baby sleeps a little bit and wakes up and does stuff and goes back to sleep. So wait until the baby starts moving and count to 10. This mother felt the baby move at 10 minutes to 7 and said, well, I have some time now, I'm going to pay attention. And she counted to 10. When she got to the 10th movement, she stopped, and that happened to take 38 minutes. She wrote the time down on the card. So, and 38 minutes is a good number, but actually the average number of minutes to feel 10 movements is 11. And that means half of women get their 10 movements in less than 11, maybe 4 or 5 minutes. Some nights, 44 or even 55 minutes, but not allowed to go past an hour. If it goes over an hour, you have to do one of two things. Either wait till the baby wakes up, start counting again, get a number less than 60 you can put on your card, and you can fall asleep that night knowing your baby's going to be fine the next day. If, however, it's late and we're worried that we're going to fall asleep and we don't have a movement count for tonight of less than 60 minutes, then we always go to the hospital tonight. That way we can reach out and find the baby that needs us. 9 times out of 10, a baby that's brought to labor and delivery because of abnormal fetal movement counting at night, the baby is fine. But it's that 1 time out of 10 when the baby reaches out, has a cord problem, has something we didn't ever suspect could be a problem, that we can reach out and help that baby so that we have a mother and a baby and a family together at the end of the pregnancy.